Yeah, you know, we as oncologists get very scared when people come in with bags full of supplements. Now, I worked in a health food store, and I make it my business to know every supplement, but in general, we're scared of it, and we say, oh, no, 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 get away, get away. But these are foods. These are foods you're talking about.
Some of them are foods.
Yes.
So I make it a point to build bridges with oncologists of relationships so that an oncologist has someone reliable to say, are these supplements okay or not? Because there are supplements that you can take during chemotherapy.
Let's talk about the cans.
Right? So
let's talk about the can
vitamin D you can take during your treatment.
So important.
D is one of the most important vitamins to keep your blood levels up because it keeps cancer from spreading.
Yes,
right?
and everyone's deficient.
Almost everybody is.
It's like an epidemic.
Yeah. So this is what I tell people, go, well, can't you get vitamin D from the sun? And I say, well, if you ran around on the equator naked, you probably could.
I like that. That's great.
But otherwise, you know, our hands get exposed, maybe your legs, your arms, but it's not enough exposure in modern life to keep our blood levels up. And some recent research, they moved the normal up from 30. One researcher says 75, right? Wow. But I say between 55 and 80 is pretty safe.
Okay, so vitamin D, no
vitamin
brainer.
Vitamin D, probiotics.
Oh, no
probiotics,
side effects.
we just talked about
Love
that.
Those.
The Chinese mushrooms. These are really, truly food-like, but these are special kinds of foods. They're like Ganoderma is reishi mushroom. A lot of people have heard of that. And this is considered the mushroom of immortality.
Yes.
And it was also used for supporting meditation practice. And it's said to open up your energy to the spiritual.
Yes.
And so that's important to some people in this journey where you face your mortality. But it's an immune modulator.
Yes.
It also has signaling to insulin, so it helps stabilize blood sugar, normalize blood sugar, and is anti-inflammatory. And also for patients who are going through chemo and their white cells get depressed, it's one of the great ways to keep your white counts up. And therefore your immunity, right?
I have a confession, Dr. Nalini.
What is it?
I take mushrooms every day.
So do I.
And is there a specific brand that you can recommend, or I mean, is there like a type of mushroom? Is there a preparation that you like more than others?
What you want to look for if you're buying mushroom products is cold water processed, right?
Okay.
Because the water processed preserves some of these immune modulating properties. So the cheaper products aren't. They're just ground up mushrooms.
Yeah.
Right? So you want a water extracted, not an alcohol extracted, because those become different medicines. You will see alcohol extracts of Chinese mushrooms, but the most potent are the water extracted. And so you want to look for that. There are brands that will say that on the label. But you know, you can just add mushrooms to your diet. Even the little button mushrooms that we put in our salads have these properties. And mushrooms...
I'm thinking I have to take pills.
All mushrooms are high in CLA, conjugated linoleic acid. And this has some anti-tumor activity, anti-inflammatory activity, and insulin, blood sugar regulating activity.
Tonulin. Is that what they... CLA?
CLA is one of the healthy fats. That's what it is. It's rich in cottage cheese.
Weightlifters take it because it's supposed to like help you burn fat.
It helps you burn fat, but it helps you burn fat because it lowers your insulin, and insulin is a fat storage signal. Right? Okay, so cabbage family vegetables. Right? So cabbage family vegetables are full of sulforaphanes, and these are sulfur-containing molecules that actually change every part of the life cycle of a cancer cell. And so these are so powerful. So the most potent in this family are kale and broccoli sprouts, right? Those have the most sulforaphanes. But you have to actually lightly steam the broccoli and the kale to really get the benefit out of it. And that's true of tomatoes, too. To get the lycopene out of tomatoes, you have to actually cook them a little bit.
I That's good, because I'm not a huge fan of raw broccoli. I like to steam it a little.
Yeah, it actually liberates the sulforaphanes to your digestive tract and makes it more useful.
I've actually seen like supplements for like colon health. That is like it's like the healthy chemical from broccoli, and it's in that group that you just mentioned.
Yes, but you can eat Brussels sprouts, cauliflower, red cabbage, so you get some extra quercetin. Anything that's that purple-red color, like the red skin of apples, that tells you that there is quercetin. Red onions, right?
Yes. That's good for allergies, too.
Well, quercetin turns off histamine, but it also has very potent anti-tumor activity.
Dr. Steven Eisenberg.